Delighted that everyone is here today to take part and witness our press conference on the war on women that we see that's happening now. So first of all, a special thanks to Channel 22. We really so appreciate your coverage of all that we do, and similarly for the Gazette, we appreciate you being here too. So my name is Leslie Tarr-Laurie. I'm the President CEO of Tapestry Health, and I'm also co-chair of the Mass Family Planning Association. What I wanted to do is to first thank very quickly a few of the Tapestry staff who rearranged this room so everyone has been awing at how gorgeous it is. And we'll see who has strained muscles tomorrow. Special thanks to Hind, who's putting together all the food, Amy, Britt, who organized this whole event, chairs, everything. Thank you, Amy. Maureen Labby, who also lugged everything around. Brooke, who's our videographer and our social media maven. And you can see how much she loves family planning. She's wearing an old t-shirt from Nifra. And then a special welcome to Manola Fernandez, who is a leader in Brazil for women, and especially breast cancer. And she's with Tapestry for the next 2 weeks, and we're really honored to have her witness our process here in Western Mass. I want to just quickly to introduce the people from Mass Family Planning, who are the backbone of why we have family planning services across this Commonwealth. First of all, Elaine O'Reilly from Governmental Strategies, who is our wonderful lobbyist, and we say that not pejoratively, but with love. Linda Sampson, would you like to stand up? The co-chair of Mass Family Planning. Linda is with Citizens for Citizens. Her organization works in Fall River and Taunton, and she is the one who's really led the Mass Family Planning Association for more years than she would like to count. Then Joan Whitaker, would you like to stand up? Joan is with ABCD, the largest family planning organization in the Commonwealth, and they provide services in Boston, in Chelsea, Revere, Quincy, and Waltham. Deborah Dill has also come from Boston, the clinical head of ABCD, so we're really glad for people to have come this way. Then with Health Imperatives, we have Ruth Aaron, who is the CEO of Health Imperatives, which serves the southeastern region, including Cape Cod and the islands. But what we're delighted about is she really comes from Greenfield, so she's come home. So thank you, Ruth. And then Health Quarters, which is a really important organization in Essex and Middlesex County. Gabrielle Ross is the executive director of Health Quarters, and Roberta Moss is someplace here. There she is. And then Elizabeth Tarrant, I'm sorry, I didn't recognize you, with Health Imperatives too. So people have come all across the state, including Kelly Warner from the Cambridge Alliance. And what the Cambridge Health Alliance serves is Cambridge, Somerville, Everett, Malden, and Revere. So we're really delighted to have Kelly and such an important organization part of the Mass Family Planning Association. So that's who we are, and that's why we're specifically here today. We also have our national leader, Claire Coleman, who also has spent formative time in Western Mass. We feel everyone needs to do that. Elaine O'Reilly graduated from UMass. We're glad that Claire Coleman graduated from Smith, and has had a really exemplary professional career in public policy in DC, has worked both in the federal government and also with other private nonprofits, specifically with reproductive health. You can read her really exhaustive biography in your packets. We're really also very pleased to announce to all in Western Mass that Claire Coleman has a planned child that she's about to have. So she'll tell more. But why we are really here today is for a very serious matter. And what we are attempting to do is to really give voice to more than 100,000 men and women in the Commonwealth who count on public support for their family planning and sexuality health services. We're here today because next week the Massachusetts House of Representatives will be voting to decide what its part of the state budget will be. That will start in July. We had actually hoped that Massachusetts had forever shed its reactionary and anti-choice and anti-contraception moniker. It was Massachusetts that brought us the Comstock laws. It wasn't until 1966 that it was legal in the state for married women to have contraception, and 72 for single women. We had come a long way, baby, or we thought we had. As a result of state and federal supported family planning, we've just heard headline news that tells us that teen pregnancy rates are down. We know that millions of dollars have been saved, and we know that for every single dollar spent on family planning, close to $4 is saved. But the background for the war against women and women has moved to our own territory. So it isn't just Texas, it isn't just New Jersey, where politicians are playing politics with women's lives and attempting to eliminate all support for such a fundamental health service as birth control. It's right here in the Commonwealth. Just last week, a Representative Lyons from Andover proposed an amendment, which is number 575, which will go down in infamy in Massachusetts, because it would eliminate every penny spent for family planning in the Commonwealth. This amendment needs to be defeated next week. Fortunately, we have a Representative Schmidt from Westboro, who, what? Westport. It's in her area. Who is supporting Amendment 786, and that amendment must prevail. Fortunately, there are some of our representatives in Western Mass who are already supporting this amendment. Rep. Sybeck from South Hadley, Cheryl Coakley-Rivera from Springfield, and Populo from Springfield too. But many more need to sign on, and we need to raise our voices to ensure that the amendment, which would finally restore sufficient dollars for family planning for the Commonwealth, to ensure that everyone who needs services will be able to receive them. To use the example of Tapestry, last year more than 15,111 visits occurred at our 8 sites across Western Mass. And most people know that the poverty line for our country is only $11,170 for a family of one. 93% of all of Tapestry's clients are under 250% of poverty, and 73% of our clients make less than $11,170 a year. People need these services. They can't afford to pay for them themselves. And clearly, with enormously high deductibles, even with Commonwealth Care and Commonwealth Choice, people need to be able to go to family planning centers across the Commonwealth. We all of the people that I've named, do all of the services that I'm naming for Tapestry. So, birth control services. And last year, we provided more than 6,613 pregnancy tests and provided 1,953 emergency contraceptive pills, eliminating the need for abortion for close to 2,000 individuals because the state supported our ability to provide preventive birth control. While we say a war on women, we know at Tapestry that 20% of our clients are men, and men who have taken responsibility for their sexuality and reproduction. So it's a war not only on women, but men and families in the Commonwealth. So this awful retreat hurts us all. I am a veteran family planning family planner, and sadly have been through quite a number of our battles. And I had actually thought that after 39 years, all of these skirmishes could have ended and we could have declared victory. But in 2012, I am very sad to say that we cannot say that yet. But we have the ability to ensure that this Commonwealth makes good on its promise. That started in 1973 when it finally supported public support for family planning. And just a few blocks from here, Margaret Sanger, who is truly the grandmother of our field, has all of her papers. And her words, I think, have inspired this organization, Tapestry, and many of us for a long time. And what she said was that no woman can call herself free until she can control when and if she will be a parent. And that's something that is for all of us to fight about and fight for, to ensure that an important vote happens next week in the House, a few weeks from that in the Senate, and to ensure that the governor also appreciates the amazing work that the people in this room and others across the Commonwealth who work in these organizations have done for these life-changing and life-saving services. So thank you all for what you do, and now we need to ensure that our legislators know the importance of this work. Thank you. Whoops. Yes, we have very high-tech things here. But no pockets.
Thanks very much.
Thank you. This is Claire.
Hi, I'm delighted to be here. I'm Claire Coleman. Thanks so much for having me. At the National Family Planning and Reproductive Health Association, we represent provider systems all across the country doing the same work that's done here in the Commonwealth of Massachusetts. And I want to start by just mentioning where we're at today and how strange it may seem to those of us who are trying to raise families responsibly, meet our budget, and fulfill our dreams for ourselves and for our kids. You know, the Centers for Disease Control, the U.S. Centers for Disease Control and Prevention, have named access to contraception as one of the 10 achievements of the 20th century, the top 10 public health achievements of the 20th century. It changed not only women's lives, but the lives and health of millions of people around this country. The fact is, when births are planned and spaced, women are healthier during pregnancy and at delivery, babies are healthier when they're born, and infants have better outcomes during the critical early months of their development. That's why family planning makes good public health sense, because it supports the cornerstone of families. But it also makes great sense for the public purse. As Leslie mentioned, every dollar that we spend investing in family planning services in organizations like the ones across the Commonwealth of Massachusetts results in savings back to the taxpayer of up to $4 for every dollar we invest. Why is that so? Well, because across the country, not just here in the Commonwealth, the Medicaid program will trigger health insurance coverage for a woman if she becomes pregnant. So they won't, in many cases, help a woman prevent pregnancy, but once a pregnancy is triggered, the state will assume responsibility for prenatal care and delivery, because the state has an interest in the health of the woman, but also the outcome of that pregnancy. And so when you expand access to family planning care, in all the ways that we do in the Commonwealth and around the country, when you provide additional access, what that means is that the state actually saves money. So that's why we think family planning is good for the public health and it's good for the public purse. And that's the reason why the Centers for Disease Control named family planning as one of the top 10 public health achievements of the 20th century. But right now it may feel like you're living in the 18th century, right? Because of the enormous numbers of attacks both at the federal and the state level. So at NIFR, we represent the interests of public health providers all across the country, as I mentioned, and we do our work in Washington. So just about a year ago, for the first time ever in the history of the federal family planning program, Title X, Congress took a vote, the U.S. House of Representatives took a vote to eliminate the program. just take all the money away. And that had never occurred in the history, the 40-year history of the Title X program. What would that mean for systems around the country? So if you think about all of the services delivered through the Title X Family Planning Program, we see about 5.2 million women and men in the program. About 93% are women and about 7% are men. So here in the Commonwealth, they're seeing many more men in their family planning programs than we see across the country. If those services were to go away, the needs of millions of people would not be met. With the resources we have in the Title X program today, under $300 million a year, we're seeing about a third of the need nationally. And that's because Congress gets to decide each year how much money we spend on these programs. So the fight that we have in Washington is now being echoed in the Commonwealth. In Washington, we fight to say there are 2/3 the number of people that research shows need access to publicly funded contraceptive care. Contraceptive care that's going to keep them healthier and make sure the families they eventually choose to have are healthy as well. With the funds we have, we're seeing about 1/3 of the need. And we're fighting just to hold steady. Last year, after the attempt to wholly eliminate the Title X program failed, there was budget cut after budget cut. So in fact, the federal Title X program took about $24 million in cuts, or almost 7.5% in cuts, in one calendar year. Congress actually does its work so slowly that that was over 2 fiscal years. They were so late in doing their budget work that the impact was felt in systems in 1 year. So a 7.5% cut imposed across the country. It fell more heavily in certain systems than in others. But let me tell you in the simplest of terms what it really means. When you're a safety net system, you are combining different sources of income in order to keep your doors open. So public funding is extraordinarily important. Here in the Commonwealth, you're lucky enough to combine federal money and state money. In many states, there's no state resources available, but here in Massachusetts, there have been. And so our systems combine that federal and state money to get the doors open. And then we rely on patients to pay a small share of the cost of their care. And some systems are also raising money in the community, asking supporters to help them do their good work. So systems have really faced a triple whammy in the last couple of years. First, the public support, the funding support is dwindling. The public support, actually, I think is quite high. I think if you went around and knocked on a lot of doors, people would say, why are we having this conversation? This is ridiculous, right? Contraception is universally used, universally accepted, extremely popular. But the public dollars have been going down. So the first whammy is your public support is falling. And folks are trying to make good budget decisions, keep hours, keep doors open, keep centers running with less government support. At the second time, patients are less able to contribute to the cost of their care. And that's really important because it's the patient portion of the fee that also helps centers run. So no patient ever pays 100% of the full cost of care. We're subsidizing all the care that's happening in the systems, but patients do contribute based on income. So when patients say they're less able to pay, our systems say that's all right, because we don't turn people away from care in the safety net. So that's the second whammy. And I'm sure for many systems across the Commonwealth, they're experiencing what I experienced when I ran my system in New York, which is our supporters in the community are also less able to be generous. And a lot of people have been very generous in supporting organizations like Health Imperatives, like Tapestry, like ABCD, like Health Quarters, all around the country for many, many years. But people right now in this recession are less fortunate. So that's the third whammy. That's why it's a triple whammy. Cuts to public money, patients less able to contribute to the cost of their care, and community supporters saying, I just don't have what I used to have. So what we've got are systems that are really strained, and they're seeing more patients than ever before. This recession is driving people into safety net settings in record numbers. Across the country in the last 2 years alone, we've seen 170,000 new patients coming into the systems. It's really driven by the recession. People are losing hours, they're losing jobs, they're losing insurance. And they're coming into safety net settings seeking affordable, high-quality care, which they know they can find in the systems across the Commonwealth of Massachusetts. So that's why the combination of federal resources and state resources are so important to the future of service delivery here in the state. And that's why I'm so happy to be here with the Massachusetts Family Planning Association to sort of make the case with you that this need is great. People need access to contraception and sexual health services. They trust these systems here in Massachusetts to provide them with care, to be there for them in their time of need. And our systems produce fantastic public health outcomes that are extremely cost effective. So next week, as the legislature begins to consider this, it's incredibly important that folks around the Commonwealth mobilize and make themselves heard. Unlike Leslie, I don't actually think we can win this battle once for all time. I think that when we talk about contraception and sexual health, we're also talking about family and love and intimacy. And they're the hardest things we do in life, and they're the most important. And that's why that intersection between what's most important in our lives and politics really should galvanize all of us, all across the Commonwealth, to say what we believe and to insist that the legislature pay attention to that, respond to that, and provide the resources that are necessary to keep family planning systems healthy, open, and accessible to everyone who needs care. Thanks very much for having me.
What we're going to do is to let Channel 22 and the Gazette ask any questions they'd like first. And then we know they want to do interviews after.
You pointed out a couple of times during both sets of remarks that that dollars spent on family planning save dollars in the long run for the state. Why do you think that message isn't getting across?
So I think there's probably 2 points that are important. The first is often the message givers are people like us in public health. And I think a lot of folks in the legislature think that we're so invested in the health of our programs that we're actually not credible message givers when it comes to an economic message. What's been really fascinating for us in Washington, and this is a study that's broadly available and I encourage everyone to take a look at it, is the Brookings Institution, which does not have a reputation for being very engaged in women and sexual health issues, has recently produced a brand new study saying that actually the cost savings is higher than even we imagine. They say for every dollar you invest in family planning, you save up to $6. And I think it's really interesting now that organizations that are not historically associated with reproductive health or sexual health care or advocacy on those issues are starting to engage in the fiscal and economic impacts of family planning and sexual health access around the country. So I'm hoping you're going to see that change as more and more validators, independent organizations that are not historically associated with our field come forward and say, are you kidding? This stuff totally saves money.
We're watching our dollars, our state dollars, each month when we submit our bills. And we do have concern that with the increased use, as Claire spoke to, we're seeing many more clients than we saw last year. And the dollars have not increased. So we're hoping that what we'll be able to do is at least squeak through for this year. And we really also hope that some of the providers of commercial insurance cover these services in different ways than they currently do. But at this point, for our state dollars, what is important for us is to look post-July 1st. And if these amendments, one that should fail doesn't, and one that should pass doesn't, then what we're talking about in Western Mass is not being able at all to continue to have our doors open across Western Mass. And the idea that we would continue to have 8 sites would be history. we are in the red at this point. And what we need to do is, and I just wrote a piece actually for the provider, which was sent around the state. And we needed, and this was a little bit less than a month ago, we needed to raise $175,000 to be able to ensure that we ended the year in the black. And we as a business need to be able to do that. So we've made some good progress. We are having a dim sum brunch if people are interested. We're always interested in people buying our coffee. Dean's Beans has done a wonderful thing. If people buy this coffee, which is locally roasted in Western Mass, by drinking this coffee, you're helping women's health here in Western Mass and also in Pangoa in Peru, where they are growing this coffee. So we're doing everything we can to ensure we end the year in the black, but the legislature needs to do their part post July 1st, and I fear that is a real question at this point.
And lastly, you said that 100,000 people in the state rely on public sexual health services. Has that number gone up from last year?
What we've seen, and my colleagues across the state would say something very similar, and Claire has said it for the whole country. We are seeing an increase in the number of people who both want and need to use our service. In Western Mass, it is because we're affordable, it is because we're confidential, and it is because we don't turn people away. So we are seeing increased numbers. And when we said 100,000, those are individuals. We're not talking about the number of visits. And for family planning, depending on what method, or if someone's coming for an HIV test or STD treatment, someone will need to come for more than one visit. So we're seeing individuals multiple times. So that number actually understates the important work that the people across the Commonwealth are doing with very, very limited dollars.
So if you can quantify it for when I'm out there trying to tell our viewers, how much more traffic are you seeing this year compared to last year?
Where is Jeff LaFlamme? Did he?
4%.
There he is. He's our, right, data guru.
Users
4%.
are up 4% year over year.
Excuse me?
Our users, our client base has seen an increase of 4% year over year.
My DPH client base is the greatest all over in the continent, and we're up 7%.
Wow.
That's a plus one.
With, right. Any other ones want to say even a higher percentage? Do I hear? Good. Any other questions or comments? If not, really, thank you all for what you do. And now, as they say, you have to talk to every friend you have in the world who has any relationship to Massachusetts and any family member, and get all of them to be in touch with our reps. So thank you for coming. Please eat, drink, and we'll prevail.